Team Science and Patient and Public Involvement, or PPI.
Hi, I'm Victoria Bartle. I have been a public contributor since 2016. I had to stop working due to multiple long-term health conditions. I suffer from quite a few different things which cause chronic pain and chronic fatigue. So I needed to stop working for a while, and a friend of mine was involved in PPI and got me involved from there. So as my health's kind of improved over the past few years, I've increased my involvement and I do quite a few different things now.
Victoria is involved with the NIHR Applied Research Collaboration and the Clinical Research Network, both in North East and North Cumbria, with FUSE, which is the Centre for Translational Research in Public Health. She's on a funding panel for NIHR's Research for Patient Benefit Programme, is the PPI lead and is a public contributor on research projects and much more.
I'm Monica Jefford and I live in Coulsdon, Surrey, but my PPI takes me around the country. And it all started 20 years ago. Sadly, my partner had just died, so I had that to deal with. But I also had some physical symptoms and went to the doctor, and I was diagnosed with colorectal cancer. It was whilst I was in hospital that somebody approached me and asked me about being involved in the local network. As with all these things, it grew on from there, and the rest is history.
Monica has been involved in the NIHR Research Design Service in London and the National RDS Public Involvement Community, in the Clinical Research Network in South London, in NHS England's Bowel Screening Partnership Board, in work with the Royal Marsden Foundation Trust and Guy's Cancer Cohort, and has been the PPI lead and public contributor on several research projects, and much more. So, thinking about PPI in team science, in your experience, what works well and what are the challenges?
So my great believer in any group is that, you value the people that you've got within the group. So it's sort of really knowing them and making sure that they're aware of what they're coming on board with and how it's happening, that they understand what it's all about. We see ourselves as a team, that we try and do other things other than, just what we've got to do. So I make sure that I don't keep anything secret from them. I communicate with them. So you have the human aspect, that you make them feel involved as they are with the trial, but also as a human being, that you realise they have a life outside, and if things aren't so good, because one of them's got grandchildren, she quite often comes scuttling into the meeting late because she's been held up. So you don't hold it against her, you just join in with her and ask her more about them. We have regular meetings, and to that meeting not only come the patient, people like myself, the patients, carers. We also have the trial manager and we have the BRC lead. So we have those people coming, as well as have the research nurses coming to share their lives with us and to hear what goes on. And on the next particular meeting, we've been trying to get her for a while. We're getting the economist is coming to do the health economics bit to see how we're fitting into all of that. And with the cancer cohort, when they had a conference, they were going for an award at some plush hotel. Then there was no second thought. We were included in going to that event and things like that. So to me, that recompenses for other things. So it's just really making the people feel valued.
The funding committee, obviously, there's 3 public contributors on my committee and everybody else is clinicians and researchers. So there's the potential for a dynamic where PPI is separate. I think we are separate, but we're not less than or more than or anything. We're equal but separate, and we do tend to stick together, like on breaks and things. As a public contributor on a funding panel, I feel respected. I feel like I can give my views, I can say, because I tend to be quite harsh, because usually it's me being the holdout on my applications, wanting more and wanting better, and the rest of the group do tend to go along with that. So there is that sense of mutual respect, which I really, really like. Something that I find frustrating is when I'm the only public contributor, because we're constantly trying to get diversity and different voices, and I feel like a lot of the time it's always me with something to say, and I get some of the PPI leads around the country and in the Northeast are like, dear God, it's you again. because I will always volunteer for things, and I love doing public involvement in research. I think it's so important, and it makes me feel like I'm being useful and being beneficial. And if somebody asks me to speak, then I'll go and do it. But also we need to hear other voices. So I do get frustrated sometimes when it's only me in a room with clinicians and researchers, because I'm not representative. I'm representative of a lot of different things, but yeah, diversity and inclusion is really important to me.
What should people keep in mind when planning and doing team science with patient and public involvement?
We, as I said, mentioned earlier on, a patient group at the milestone. We sit around a table with tea and buns, and we'll discuss the research and come in, give their presentations. Anyway, to cut a long story short, on this particular occasion, the one that was coming our way was a pathologist, somebody from the sort of bowels of the earth. You looked down microscopes and everything else. And when she came up to the room, we didn't know this, but I mean, her face was a picture. She looked absolutely ashen and terrified, sort of coming into the room. And she was obviously quite apprehensive about the whole process. And then she sort of managed to get going and sort of gave us her session and realized that she needed to sort of chill a bit and make it much more user-friendly. And then she got the bit between her teeth, and it really sort of got underway. Anyway, to get to the real nub of the matter, the end comment was from somebody who had not ever crossed her mind again. She said, "I will never, ever look down my microscope again in the same way. Coming here today, I now realize that what I'm looking at belongs to a patient, a person. And, it means so much more than just a specimen, which we obviously need excellent people like her to deal with." But she saw the whole world rather than just her own little bit. And it was the best thing she said she'd ever done, and would do it again. And she went out smiling. I think what people need to realize is it's not as frightening as they possibly think. Just try and think if they were talking to their mum or their granny or their auntie or uncle, perhaps better not be sexist. They need to bring this training into medical training and nursing training, just dealing with human beings.
It is all about just equity. It doesn't matter whether you're a public contributor or a researcher or a clinician or the chair or like a local authority rep or whatever. Everybody can have accessibility needs. They can have different requirements. They might need papers in a different format because their IT doesn't link with that or whatever. So it's making sure that everybody gets the opportunity to get what they need, and including public contributors and other stakeholders in mailing lists, in meetings, having PPI on the agenda for every meeting. I think it's massively important to set kind of the expectations from the outset. And there should be a lot more support for researchers to be taught how to do it well, because it's a difficult skill and it's challenging, and it's not like their normal day-to-day job. It's a totally different skill set, and there needs to be training and support and consequences and like reward and recognition for it. I think is hugely important. But generally, as long as you're keeping your public contributors informed, you're treating them the same as everybody else and part of your team, that PPI is a consistent on your agenda, then I think that's probably one of the best ways of working. I think group facilitation and trying to engage public contributors is so important as well, because a lot of the time you go to a meeting and the researchers tell you what they're doing and then you give a bit of feedback. Like that's fine, but it's quite boring and obvious, and it does put barriers up for people getting involved. I think having more creative involvement methods is so important, but then how do you learn how to do that? Yeah, it's not part of the curriculum, I suppose, in becoming an academic researcher. And if you want it to be a vital part, then it's got to be.
Thank you so much to Monica and Victoria for sharing your views.